coronavirus in the country. Today we mark exactly 2 months since we recorded our first positive case of coronavirus. It has been a solid 2 months during which our daily lifestyles have been completely altered. We have advised Kenyans to stay at home and to regularly wash their hands, among other measures. Our economy has been impacted negatively and our livelihoods destabilized. These effects are not unique to Kenya. All countries that are fighting COVID-19 have had to contend with these problems. We have aggressively confronted the virus by instituting stiffer measures as part of the interventions against the disease. As part of our response, we have expanded our national testing capacities from the initial 2 testing laboratories to 16, and we're in the process of expanding even further. Yesterday, during yesterday's briefing, we did touch on the issue of testing, and I think we also touched on the challenges that face us in this area. We have mentioned before that we do have the testing capacity, but we are sometimes limited by the unavailability of reagents, which is a global problem. It's not only in Kenya. It is difficult to receive a steady supply of commodities for this testing because of the global demand that exists. But we have been fortunate enough that we at least have had a steady stream of supplies that has enabled us to record the levels of testing that we have recorded thus far. We could do more, but we are constrained in that sense, and we will continue to try to explore how we can scale up this testing to higher numbers. I am glad to note that the county governments have also expanded their levels of preparedness to effectively manage the disease at the community level. They have established and equipped isolation and quarantine facilities across their counties. Remember, this is where our fight against the disease has now moved to. You have seen during our daily reports that the number of counties affected keeps increasing. And it's inevitable that very soon this disease will have spread throughout the country, with every county recording a case or more of COVID-19. All these developments are geared towards flattening our curve by containing the disease. And we need to sustain this effort if we are to be able to manage this response and tide the country through this very difficult time. Today, as we move into the 3rd month, I want to make a special appeal to Kenyans. I want to request every individual to be their brother's keeper. If we move together in this fight, we shall overcome. I'm therefore urging our people to report to a nearby facility should one notice symptoms associated with COVID-19. This will ensure that they can be assisted before their condition worsens. We have observed instances where some of our people have delayed to visit health facilities, resulting in grave consequences. We want to encourage Kenyans not to fear going to health facilities to seek care. Our health facilities are safe. We have put in all the measures to ensure infection prevention and control. Therefore, do not fear to go to these facilities seek the care that you need. Even if you do not have COVID-19 symptoms, please do visit these facilities voluntarily so that you also know your status. When you know your status, you know what action to take. We are encouraging Kenyans to come out and be tested. When we have targeted testing campaigns, we want Kenyans to come out in their numbers in those localities where we are doing this exercise so that you can be tested, and we know where the enemy lies, and we will know how to deal with that enemy once we know where it is. Our priority intervention measure in the new month is to limit community spread of the virus, recognizing that the virus requires a sound public health response. We will fully support our frontline healthcare workers and other workers as well in providing technical expertise on case management as patients seek to address the community spread. Fellow Kenyans, we have noted with concern also that, especially at our border points, we are seeing increasing numbers of positive cases. As we monitor the cases at some of these points, for example, along the Kenya-Somali border, particularly in the area of Wajir and Mandera, we are seeing cases that are resulting from people who have either traveled across the border and come back, or people who have coming from the other side into the country. This kind of movement is what causes the spread of the virus. For those communities that live along the borders, especially those borders that are long and porous and difficult to monitor, our Kenya-Somali border, the communities that live along there, we want to encourage you to be your brother's keeper by being vigilant. And when you see people coming across from the other side, you inform the authorities so that if those people can be tested and isolated if necessary, if they turn out to be positive. We need to stop this spread. We need to stop importation of the disease from other areas. So we are urging the communities along those borders to keep a keen eye and to report any movements that they see across the border. It's very difficult times, and we know that Kenyans are just like anybody else and all across the world have their concerns about COVID-19. We have seen that there is a lot of information out there, some of which factual, some of which is not based on any evidence. For instance, if you look at the use of traditional medicines and herbs, we want to tell Kenyans that many of these products that are out there do not have any scientific evidence as to their effectiveness. But more importantly, we know that in a situation like this, there will be some who want to profiteer from this uncertainty by purveying products and claiming certain advantages to their products. I want to ask Kenyans not to fall for that and to keep away from some of these claims that may be brought about by people who want to sell products that are not based on any scientific evidence as to their effectiveness against COVID-19. Having said that, it doesn't mean that we do not want to encourage local solutions for this disease. In fact, there's a lot of work, particularly on the traditional side, we're encouraging our institution, KEMRI, to look into this area and to carry out some studies of the effectiveness of products that could work for us in this. So we want also to encourage, but in a systematic and a scientific way, the exploitation of some of these traditional medicines that we have. Pertaining to our COVID-19 situation, let me report today on the results of the testing that we have done over the last 24 hours. We have tested 841 samples, out of which 28 have tested positive for coronavirus. This number is distributed as follows. 10 of these cases are from Mombasa, 9 are from Kajiado, 7 from Nairobi, and 2 from Wajir. This brings to 700 the total number of those who have tested positive. Let me talk a little bit more about the cases from Kajiado, which of course is a concern when you see a large number being reported from a border county like Kajiado. The 9 cases from Kajiado are all Kenyan truck drivers who were returning from Tanzania and tested at the Namanga border point. These 9 cases were positive among the other drivers that were tested. At the same time of testing truck drivers at Namanga on the Kenyan sides, that's the Kenyan drivers, we also test Tanzanian drivers who are intending to enter Kenya through that border. We provide a service to them. They are sampled while they are on their side of the border, and we conduct the test. 5 of those Tanzanian drivers who are on their side of the border waiting to enter Kenya were found to be positive. So when they are found positive on their soil, it is now for the Tanzanian, we share the information with the Tanzanian authorities. They will then be able to take up those cases to isolate them and as well do the contact tracing on their side. The spread of positive cases by estates is as follows. Mombasa, Mvita 3, 2 each from Changamwe, Kisauni and Nyali, and 1 from Likoni. In Nairobi, the cases are from Kenyatta National Hospital, 3, Embakasi 2, and 1 each from Kibra and Pumwani. In Wajir, the cases are from Eldas and Tarbaj. On a positive note, we have discharged 12 people from hospital today. This now brings to 251 the total number of recoveries from COVID-19. We continue to thank our healthcare workers for these successes that they are registering in the recoveries that we are seeing. On a sad note, we have lost 1 patient in Nairobi. This now brings to 33 the total number of those who have succumbed to the disease. And we take this opportunity to send our heartfelt condolences to the bereaved families and friends. In order to enhance our communication, I want to inform you that the government has launched a WhatsApp BOT facility which will contain basic information on COVID-19. The WhatsApp number is 011 071 9719. I'll repeat that WhatsApp number. It is 011 0719 719. This platform has an embedded, simple self-diagnostic tool to provide information on COVID-19 as requested. I urge Kenyans to seek information and to use this platform. Yesterday, we informed you about protocols that had been developed for hotels and restaurants to open. Today, at a meeting held with all stakeholders in the industry, we have agreed that the protocols must be followed by all hoteliers. A technical team representing all stakeholders has been constituted to address areas of challenges and tasked to submit a report on the way forward within the next week. Finally, once more, I want to appeal to Kenyans to come out when we go out for testing campaigns, and we will be stepping up these testing campaigns very soon. We shall inform you where we shall be setting up camp, and we want to encourage Kenyans to present themselves. Of course, we will still go back to some of the hotspots that we have been looking at as well, but we shall expand it to other areas too. I'll stop there, and I want to thank you. And I want to now invite CS Balala, who has joined us. He was here with us yesterday. He promised he was going to come today and give a report. So we'll give him the chance to give his report. Waziri.
Thank you very much. Thank you very much, Dr. Rashid, and the Director General for Health and the team from the Ministry of Health. First of all, I want to thank the Ministry of Health for collaborating with us in the Ministry of Tourism and the stakeholders this morning. This morning, we held a meeting between the private sector, the stakeholders, from the Hotel Association of Hotel Keepers and Caterers, from Pubs, Entertainment, Restaurants Association, and the Retail Trade Association of Kenya, plus the Director General of Health and his team, and my office. So we have agreed on the following: that it is the responsibility of every restaurant or eatery seeking to reopen to access the protocols as published by the Ministry of Health. So those protocols have not been revised. They are still the same, but they need to be followed. But also we have agreed every establishment will develop their standard operational procedures, which will be compliant to the protocols. We have also asked the associations, in collaboration with their clients and their staff, to adhere to the protocols laid down by the Ministry of Health. Because we don't want to burden the business committee, ours is to make sure that we stop the spread of the virus to the public, but also not to stop the economy. So we have agreed the cost of tasting for the businesses will be 1,000 Kenya shillings, and I want to thank the Ministry of Health, because the actual cost of tasting costs up to 4,000 Kenya shillings, but we have subsidized as government because we want to support the economy. There'll also be no charges by the National Nairobi Metropolitan Services or Nairobi County. There'll be no charges for inspection, neither there'll be no charges also for the compliance permit. So everything will be free the minute the establishment has presented their papers to the Nairobi County or to counties for their compliance certificate. It will take 24 hours for this to be processed. So there's no delay and there'll be no cost towards this. So yes, we have established 2 teams. They'll report back by next week, Monday in the morning. One team to discuss about how do we gradually reopen the accommodation sector, which is hotels. And how do we make sure that also the restaurants, high-end restaurants, are gradually opening without floating any rules. And here I want to make some correction. When we do mention hotels, we do the literal translation in Kiswahili, mahoteli. Mahoteli, kuna zile ambao zina mahoteli na vyumba vya kulala, kuna yale ambao mahoteli ni mapahali ya mankuli. So tukisema mahoteli tunasema mahoteli pahali pa mankuli, si pahali ya vyumba vya kulala. Pahali ya vyumba vya kulala mpaka saa hizi hamna ruhusa. Kwa hivyo tumekubaliana kuwa nidhamu hili lazima ifuatwe, na nidhamu vipi watashirikiana na ma-counties na kutocheleweshwa kwa nidhamu hii kutekelezwa. Lakini leo pia wizara imetangaza watu 28 ambao wameweza kuambukizwa kwa virusi hivi, na watu 10 kutoka Mombasa na watu 9 kutoka Kajiado. Hawa watu 10 kutoka Mombasa, lazima sisi watu wa Mombasa tuchukue tahadhari, na pahali ambao serikali imeleta vifaa vya kupimwa lazima tujitolee tupimwe, tujue kama virusi tunavyo ama hatuna. Tunaomba wananchi watukufu, nidhamu hii na sheria hizi zimewekwa kwa sababu ya kuhifadhi afya zetu sisi wenyewe kama Wakenya. Pia ni wakati wa mwezi mtukufu wa Ramadhani. Naomba ndugu zangu Waislamu wote tusifuate ile nidhamu ama zile mila ambazo tulikuwa nazo hapo awali ya kuchanganyikana na watu ama kula pamoja, kwa sababu inaweza kusambaza virusi hivi. Kwa hivyo tunawaomba, na mimi nawaomba ndugu yenu, kuwa tubadilishe nidhamu hii kwa sababu ya ugonjwa, na ikimalizika itakuwa tumerudi kwenye mila zetu na tabia zetu. La muhimu ni kuwa wale watu 9 waliopatikana na virusi hapa Kajiado ni wale madereva ambao wameweza kuvuka mpaka na wamepimwa kwenye kituo cha mpakani na wamepatikana na virusi. Na kawaida ikiwa ni madereva wa Tanzania tunawapima, na tukipata wana virusi tunawaarifu jirani zetu Tanzania kuwa madereva hawa wana virusi, na wao ndio watachukua jukumu la kuwahudumia. Leo watu ambao wametimiza watu 251 ndio wameweza kupona kwenye ugonjwa huu, na mtu mmoja amefariki leo, na sasa imefika idadi ya watu 33 kwa wale ambao wamefariki, na tunawaombea pole wale watu wao ambao wamebaki. Kwa hivyo leo langu na kushirikiana na wizara ni kuangalia kuwa nidhamu inafuatwa kwa sekta ya utalii ama mahuduma ya mankuli, na tumekubaliana na sekta hiyo kuwa nidhamu gani ambayo itafuatwa. Pia la muhimu ni kuwa lazima sote tufuate nidhamu hiyo. Nidhamu ya kuweka usafi, nidhamu ya kuosha mikono na sabuni, nidhamu ya kuvaa barakoi, na pia nidhamu ya kutotanganyikana, kwa sababu tunaweza kuambukiziana sisi wenyewe, na ndiposa tufuate nidhamu hii, na nidhamu hii ni kwa sababu ya maslahi yetu sisi kuwa na afya njema. Asanteni sana.
Museo from KBC. The counties that have been listed to have the positive or confirmed cases of COVID-19, are they a true representation of the counties affected that far? And number 2, 2 months on, we've been able to test only about 30,000 samples in a population of about 50 million people. Is that our target as a nation? Does it mean we still have a long way before we could talk of recovery of our economy or going back to normal?